We just wanted to send you a recorded video with some of the comments and on the feedback of the assignment one. You guys did a really thorough job thinking through both the hotline script and also the SMS survey questions. And what we wanted to do is just give you all feedback at once in this matter instead of writing individual responses to all of the groups. So what I'm showing here is actually something that Liz dug up from the USCCC website, which is actually a really nifty tip sheet for how to construct survey questions. Liz, shall we run through
Yeah,
the
absolutely.
facts?
Just a few things to think about. Survey question design is extremely hard, and it's even harder when you're trying to do it by committee. It's almost impossible to do well by committee. So I commend all of you for doing so at all hours of the night on WhatsApp with like 1,000,001 messages coming through, or on WeChat. And so we just want to recognize that you worked under very intense time pressure to develop questions in a thoughtful way. So this is not necessarily a criticism of that work and effort, but these are just some thoughts to help you reflect on survey question design for the future. And like I said, their entire PhD programs just dedicated to survey question design. There are people who have entire careers just built to do this. So don't feel like you have to become an expert in this overnight. There's many tools like this tip sheet and others that Tina will share that you can use to help you when you're thinking through question design. But there are a few basic principles you want to think about is, why are you conducting the survey? Who are you surveying? What is it that you need to know? Sometimes you don't want to ask the question if the answer is obvious or if the answer is not going to be helpful to you in aggregate. So how and why questions don't work very well as survey questions. And then also think about how it's administered. So sometimes something that might be appropriate for an SMS survey might not translate well to a phone survey or to an online survey. And the reason is that often if you're doing like a verbal survey, which such as a phone survey or a door-to-door survey where you're talking to people in real life, the surveyor might have instructions that say things like, check all that apply. So you ask the question of the person and the person talks and talks and talks. And then if they say specific things, the surveyor then checks off the correct boxes within their list. And so that is one example where the surveyor is essentially filtering information that is being shared by the person who's taking the survey. And so one of the problems with SMS is that you're essentially displaying what the answers are, which could potentially bias the survey because you're essentially offering potential correct answers. So how about we walk through some of these common pitfalls that you might want to avoid when constructing your survey questions. So let's start with, there's one here that's not, I would start even with before this. I would start with a really terrible survey question that there's no way to answer this successfully. And the question is, when did you stop beating your wife? There's no good way to answer that question if you have to give a number as a response. And the point is that the design of the question as well as the answer formats that you're providing really can heavily bias the question and can make it difficult to get the responses you want. So there are additional pitfalls here, but just to give you an idea that there's a lot you have to think about in terms of how people receive information, how they process that information. Do they understand the question as you intended? And then how are they responding? And does that response actually reflect reality, or are they responding in a way that they think you want them to say or that you want to hear? And that's confirmation bias and a social desirability bias of, I want to say the correct answer because the person asking me the survey, I want them to feel good about me and feel like I'm a smart person. And confirmation bias is this notion, I will answer the question that is very aligned with my thinking and my worldview. And I'm not interested in other potential answers to this question beyond what I think and feel. And so some pitfalls that you can think about. Number one, double-barrel questions. And these are questions that contain two or more things that are being asked in a single question. It's a question that can touch upon more than one issue, yet allows for only one answer. So an example here is, do you have high blood pressure and high cholesterol? So right now, if you say yes, that means yes, you have high blood pressure. Yes, you have high cholesterol. That's a problem because in the analysis stage, how do you analyze the no answer if someone has high blood pressure but not high cholesterol? And so that's one example of a double-barrel question. Do you want to talk about introducing bias, Tina?
Sure. So what you also need to be really careful about is when you're formulating the question is that you don't actually lead the question with words that may influence the way that someone would respond. So, for example, in this example, you're making an explanation. Exercising every day is important, and then you follow up with, do you exercise every day? So of course you can actually influence the person's response. They want to feel good. They want you to feel that they are doing the right thing, and that so of course you may be encouraging them to be good and respond as always or sometimes that they're exercising. So you need to formulate your questions in a very neutral way and without indicating what your how you would be interpreting the responses or how you would be valuing them. So you see here in the revision, you make a very plain question: do you exercise every day? And then the respondent responds. So you need to be really important. So this is an example of when you have this type of leading within the question, but also you need to be careful that you don't foreshadow or pre-inform the person taking the survey with previous questions or questions afterwards. What you're actually asking questions about. I mean, these are all test taking techniques that sometimes in school they were teaching us. Well, maybe you can figure something out based on, what the teacher was asking you on the test before and after. And this is just something that we naturally tend to. So you need to be really careful that your questions are as neutrally and posed without any introduction of bias in it. Do you want to go to the next one?
Yeah,
Yes.
and then maybe just to add here is that you also need to be very careful about interpreting questions that try to measure people's reported behaviors. So if you have the question, do you exercise every day, always, sometimes, never? And let's say 50% of people say always, you cannot say 50% of people exercise every day. You would not know that from the survey question. The only way you would know that is if everybody had like a Fitbit or an Apple Watch or some kind of fitness device on where you were able to track that, yes, 50% of the respondents do indeed exercise every day, right? There's no way to know this for sure based on just a survey question. So when you're parsing responses to these questions in analysis, you want to ensure that you're saying 50% of people reported that they exercise every day. And let's go to the next question about in a typical year, how often do you visit your doctor, weekly or monthly? What's the problem with this question? And that is that the response options really don't match the question, or they're not expansive enough, or they don't make sense. So that's a balanced question response type issue. So a better example is, in a typical year, how often do you visit your doctor? Once per week, one time each month, 2 times per year, 1 time each year, never. You're much more likely to get higher quality outputs from a question like that versus something that has only a few options where you're not offering more possibilities for what the response could be. And then finally, negative items. Answering negative questions can be very confusing to your respondents. Do you typically not eat vegetables every day? And there's like, wait, what? And so a better way to formulate that is, do you typically eat vegetables every day? So you really want to make sure that you're not placing the question in a negative, because it can be difficult for the respondent to parse what you mean. And this is why it's very important in the real world to always do cognitive testing or pre-testing of your questions to make sure that the questions are clear and that they're understood by your target audience and that they're able to answer the questions in the way they think you're asking the question. And so these are just a few tips and tricks. So Tina, do we now want to check out some of the survey responses and walk through them?
Sure. maybe one thing also, we're going to go through the examples of what you guys submitted, but another thing that's really important, and Liz already a bit alluded to it in her discussion right now, is that, one thing is, an approach to how you design the questions, how you pretest them, and when you administer the survey. Then there's the next step of, when you receive the data, how do you interpret it, and what do you know about the data source, how the survey was actually administered, and how does that affect your ability or the types of conclusions that you can make from the data? So remember in Elnor, what you received as information was that the survey questions need to be very short, that you cannot get any geolocation data from the responders, so you will only get an aggregate data set, and that the coverage of the network of Elnorcon is spotty in the south of the country. So whenever you're also making any type of conclusions about the responses that you received from this type of data set, you need to be aware of this. And so when you receive the data set with the responses, think about that as well. And maybe now we go back to the question. So you should see the projected questions that we received from all of the groups. And if we look at the first two, I actually didn't count the length of the characters. But all right, so what would be some of the things that I would notice in the first two is what are the best ways to protect yourself from COVID-19? You only have positive answers regarding the proper or the expected behaviors, self-protective behaviors of COVID-19. The E option is all of the above, but there is no option to say anything else other or any other. So you actually are guiding people towards responding correctly to you. And in the second question, there's also no option for the respondent to say that they have some other source of information on COVID-19. You are assuming that these are the predominant ways that people receive information. How would you know, and how do you check your assumption if you do not provide an option for people to also indicate to you that what you provided them as options to respond, that doesn't fit what they actually would like to tell you? Liz, for the first two?
Yeah, and something else as well is that it depends, but what does keep your distance mean? So one of the challenges that we've had in survey questions earlier on in the COVID-19 response is social distancing meant different things to different people, and it can mean different things in different countries. So is it 1 meter? Is it 2 meters? Or is it at least 1 meter? So all this to say that this is where, again, the real world, you would make sure that when people hear or read keep your distance, what does that mean to them? And does that actually align with what you think keep your distance means, or at least from a public health perspective? So a lot of it comes down to definitions. And limit social gathering. Does that mean 25 people over at a birthday party? Is that considered to be a limited social gathering instead of 50 people at your birthday party? What does that mean? And again, this is extremely difficult. We asked you to do something very hard in a very short amount of time with very little guidance. But these are just some of the considerations, and we're hoping kind of talking through some of these might be helpful for thinking through future types of survey questions you might be designing in the future.
Right, so here's the next two. So the first one, do you believe that hand washing, wearing face mask, and social distancing practiced together will limit the spread of COVID-19? It took me a while to understand it, to be able to answer yes or no. I have to evaluate hand washing and wearing a face mask and social distancing, and then the questions asking me practiced together. So I'm fairly certain, there was a good reason why this was formulated this way, but it's an extremely difficult thing to quickly answer in an SMS survey. And I'm not sure how this would be interpreted. How would we use this information when people answer yes or no? Liz, what do you think?
Yeah, and not only that, this assumes that you've heard this before, and it's just asking if you believe it or not. So maybe you haven't heard that you're supposed to be hand washing and wearing a mask and social distancing all at the same time. This assumes that you already heard this message and you formulated a belief on it. This is like asking people's opinion about whether they think the moon is made of cheese. It's like, well, I mean, unless you thought about that before, you probably don't have a very strong opinion about it. So you want to make sure that not only how you're formulating a question, but even the responses. Generally speaking, rule of thumb, you want to have a yes, no, don't know. Because sometimes people just don't have an opinion or haven't thought about it deeply. And that is also instructive and helpful in the analysis stage, as opposed to people who are definitely yes or no to a response to a question.
Right. And the next one?
How confident are you about your knowledge about how COVID-19 is transmitted? So this is very interesting. People in general will rate themselves very confident on anything that they themselves are supposed to know. That's like saying, like, how confident that you are good looking. Generally speaking, people will want to say, yes, I'm very confident in how smart I am or how good looking I am. That's human nature. So if you're looking at confidence, maybe instead of thinking about knowledge and awareness, think about confidence in doing a behavior, or asking the question in a way where you're saying, do you feel like you have enough knowledge about how COVID-19 is transmitted? And instead of asking people to rate on their confidence scale, you basically offer a scale of something like, I don't have enough information, I have enough information, I have enough information, or I have too much information, right? So thinking about confidence in executing a behavior might be a little bit easier to parse versus asking people's confidence about their knowledge about a subject, because either you know it or you don't.
Mm-hmm. Here's a very creative submission of
I
2
love
SMS
this.
questions.
This
It's
is the most
beautiful.
beautiful survey question that's been submitted, for sure.
with a logo from the ministry. So the first one is, what COVID protection do you do every day? Type relevant numbers. So here, this assumes multiple choice, multiple responses. Wear a mask, frequent hand wash, keep 1 meter distance, avoid poorly ventilated places, and none. So this formulation actually is more specific with the responses. So keep 1 meter distance, etc. But I'm not sure that the SMS would allow multiple choice response. I don't think that this is something that we allowed for. And I wonder if the technicians would have been able to implement it for you. Here's the second one. Do you think you are at risk of getting COVID-19? Not at all. Very low, low, moderate, high, very high. I see the idea behind it, but I think the options are not fully logically representing answers to the question. Do you think you are at risk? No, I don't think I am at all at risk.
Mm-hmm.
My risk is very low. My risk is low. I think I'm at moderate risk, etc. So I think the scale is really good, but I think it would have needed to be phrased a little bit differently.
Yeah, and maybe to add to that, to step back a second for the previous question about what COVID protection do you do every day. Again, that is a normative question about what is it that you should be doing every day. So first of all, there might be people like, oh, I'm supposed to do stuff every day? Oh, okay. Well, which answer seems to be the right answer that the interviewer wants me to answer, or that the survey wants me to answer? And again, this is where you're going to be really careful about what has been communicated by Ministry of Health versus even WHO guidelines or other types of guidance that is given in country, because even the keep 1 meter distance, in some countries it's 2 meters, sometimes it's at least 1 meter. In the US, it's 6 feet. And so it will depend. And so again, you would just want to make sure that even before you write the survey questions, understanding what were the messages that have been used and have been disseminated widely, because we know that the guidance is constantly changing. And even though there's a lot of effort to be consistent about messaging with the public, we know that there's overwhelming amounts of information and science and insights that we're gaining every day about COVID-19. I mean, we had no idea how easily transmissible COVID-19 was through in close proximity with other people until the last few months. I mean, previously, the science was a little less clear cut. And so again, that is also going to influence the messages that are shared, and this can also cause additional confusion. This is where the infodemic part of too much information is a problem, because the freshness of the information also impacts whether someone feels like they're doing all the right things, but it was all the right things they heard about and they were told about in April, but maybe there need to be other additional behaviors or specific steps they need to be taking now that have been learned since April. So those are just some of the considerations. And to Tina's point, again, very low, low, moderate, high, very high. That seems to be a little bit harder to parse. And again, this is where pre-testing will help you figure out, does your audience understand this question, and how do they understand what these mean?
Yep. So the way that this would actually practically play out, you get this emergency request from your friend Abba in the Ministries of Health. You do a little bit of research, you think through what would be the high priority areas where you need information about. You jot it down, and then you send these drafts to a WhatsApp group of friends, infodemic managers that you made friends with at the infodemic manager training, and you do a quick pre-testing. At least get the feedback of this, if nothing else. But send it around, get it reviewed before you shoot it off to your friend Abba. That's really important for the future when you're working. So, okay, so let's move forward. So what do you feel are your chances of getting COVID-19? And the responses are low, medium, high, and none. Yeah, so here I also had to think, I actually had to pause and think what low, medium, and high mean when it comes to what is my chance to get COVID-19. What do you think, Liz?
Yeah, there's like a whole, oh man. So there's like a whole set of discussions about, like, do you do a 1 to 3 scale? Do you do a 1 to 5 scale? Do you ensure that there's no neutral? So you force people to have, a low or a high, but not a medium or a neutral. So there's many different ways to parse this. But again, this is where pre-testing to understand what do people understand or mean by low versus medium versus high. Yep. And none. That's, I'd be interested to see what people understand by no risk of COVID-19 versus low.
Yep. And then here's the next question. These behaviors protect myself and others from getting COVID-19. And then the options are washing hands, wearing a mask, physical distancing, and all of them. And here, here you are actually introducing what a desirable behavior, that you're looking for desirable behaviors, which means that you may be introducing bias by someone looking at what actually sounds protective. So the formulation would need to be a bit different, and it would be about behavior. So what kind of behaviors do you practice? This is what Liz was also mentioning earlier. Instead of asking, already introducing and asking questions about what behaviors do you take to protect yourself. Shall we go to the next one?
Yeah, so the next, yeah, exactly. So it seems like for a survey including questions with several one-word answers. So these folks, I appreciate their innovation, but technology is limited in Elnor and what ElnorCom can do. So unfortunately, these things that would have multiple responses would not work in the survey design.
Yeah, and this actually is a real limitation. I know that there's several of you from digital health background and technology, but it really, options sometimes available and the opportunities for surveying in the field that are being offered sometimes are really restricted. And, this was one of the reasons why we wrote the challenge the way that we did. Right, so here's the next two. Here's one that is trying to get at the sources of information. So where do you usually get information on COVID-19? And you have several options: healthcare workers, TV, newspapers, social media, family members, friends, and others. And the other one is a general question: who can get COVID-19? Healthcare workers, people older than 50, smokers, migrants, people with other diseases, non-alcohol consumers, or anyone. Liz, what do you think about these? The first one is answer number numbers that apply. So this would be multiple choice. Yeah, I'm not sure that that was possible in the SMS.
Yeah, again, thoughtful innovation about trying to squeeze more out of one SMS survey question, but unfortunately the technology would not allow for this. And again, what you would do is you would have these categories pre-tested to make sure that they weren't left out. I know at least in one group there was vigorous discussion about how do you label outdoor posters or banners, or billboards, and how would you describe them? This is something, again, you would pre-test to make sure. What I would do is I would also clump together family member and friends, line 92 and 93, because there's probably not going to be a real discernible difference between how you get information, how it would be, the quality of information would be different from your family versus your friends. And for who can get COVID-19, this particular question, this is very interesting. Again, it depends on the context. I know that in where I helped support previously in Indonesia, early on, there was actually misinformation that smokers were protected against COVID-19 transmission, when we in fact know it's the opposite. And so, again, this is where you want to be very, very thoughtful and careful about understanding how people interpret these categories and what that means to them. For us reading this, we might say, well, obviously smokers are a group that is at risk, just like people over the age of 50 or health workers or migrants or people with other diseases, right? And non-alcoholic consumers, I don't know what that means. Maybe it's
people
clear
that don't drink alcohol.
Non-alcoholic consumers.
That's what that means to me. But yes, I mean,
that's a lot
really
of
need to
people.
think. Yeah.
I mean, is that children? Are you trying to get at like children? Are you trying to get at like, and are you saying that alcohol consumption is a risk factor? So I think this is a really interesting question. And I think it's very interesting because you're clearly trying to understand, who do people perceive to be most likely to get COVID-19? And that can help you kind of get at like popular stereotypes or perception or even stigma. But I would be thoughtful about is this the kind of insight that would be better to get in through qualitative research, through focus group discussions, versus a survey like this? Because we know that there are multiple categories of people on this list that can get COVID-19. And even we don't necessarily have a great list of who is at most risk versus slightly less at risk, because it's so context specific and dependent. So anyway, that's a very interesting question, and that was the one I probably would answer or ask in a focus group discussion setting.
Here's the next with a bonus as well. On a scale from 1 to 5, how concerned are you about COVID-19? And then it goes from not concerned to extremely concerned. Yeah.
So I've seen variations of this question, and I know many of you actually were looking at other COVID CAP surveys for inspiration for this. So this is a decent question, but again, some people will say, well, instead of giving 5 options, because that allows people to choose 3, which is kind of like, I don't know, I'll put it in the middle. I'm not really worried, not really concerned, not extremely concerned, just kind of in the middle. So another thing you could do is force people from 1 to 4. Again, depending on context, sometimes that framing can be confusing. So I have a colleague who, Mohammed, who does a lot of survey work. And in Sierra Leone, one of the easy tools that they would use when they were doing these huge CAP assessments is that they would basically show circles, like a small circle and a medium circle and then a big circle. And it was a lot easier for people to point to the small, medium, or the big circle when they were being asked questions about, how big is a concern? Is this a concern? Or, how big of a problem? Or how hard is this? Or how easy is this to do? So, there are other ways that, again, you're limited by the SMS format. But depending on the survey design and how you're administering the survey, there might be other ways that you can try and get at degree of. And I appreciate that you're trying to get the degree of concern here. And it's also very difficult to unpack, concerned are you about COVID-19? Is that about your health and COVID-19? Is it about like your job and COVID-19, or whether you lose your job because you're affected by the economic impact of COVID-19? Is it because you have someone in your family that's been sick? So again, these are the types of questions that when you do have how and why questions, they work better in a focus group discussion if you really want to dig into why they feel this way.
Yeah, and I mean the biggest challenge in these types of very targeted survey questions that have to be extremely limited, both in length and in that also means that you need to be extremely exact with the meaning, for all of the reasons that Liz mentioned, but also from the fact that when you get the data set back, how do you even interpret what people responded to? Because if you in this example that Liz was showing, regarding what does the concern then mean? Because we're asking a general question: are you concerned about COVID-19? But if we're trying to use that data later to, uh, to make an action or a recommendation to make an action within the scope of what our mandate is and where we have the power, this question wouldn't necessarily give us the information that what we as infodemic managers that are working with WHO country office and Ministry of Health and other partners could actually do something about. We don't have the influence over all of the society being concerned, for example.
Well, it's also a
And
question of what is the right amount of concern. You don't want it to be
also,
completely unconcerned,
yes,
but not like panicked and hiding under your bed
yes.
concerned, right? So what is the not the correct, but what is the desired answer? Because ultimately you're using these survey questions as a measuring stick to find where people are at,
Yes.
right? And ideally you should have like, what is the desired answer that you would like to see versus what the reality is, and then how do you move people from where they are right now to where they need to go?
Yes.
So
and based on this, then the second question is also layered to the point where if you got the results of this questions, the responses to this, it would be also very difficult to interpret, because so your formulation here, are you wearing a mask around others? Are you keeping distance from others? Are you staying at home if you might be sick? Those all are, implying, the protective behaviors. But what does keeping your distance mean, and et cetera, that this we already discussed. But then, what the person can respond to you is they don't do any of this, they do two of these things, or they do all three of these things. How would you know what doing of two of these things means? Because actually, very likely, you want to be then applying interventions to encourage all of the protective behaviors, or understand which of the protective behaviors are not being done and what's the obstacles to it. So actually, the one thing that you're most interested in, the way that this is currently asked for, you won't be able to answer. You'll be able to know, okay, everyone that isn't doing things, which means you have to be really thinking about how you would approach communicating and also encouraging health-seeking behavior in that group. But actually, the one that is also extremely important are those that are not doing all of the three things, but are doing two, or one actually, which is not there as an option as well.
Or doing other things they think is protective, but is not actually protective.
Yeah. So here's a bonus question. How easy it is to find useful information about COVID-19? We reply with a number from 1 to 5. And I think this is very similar to the previous discussion that we had.
And my question is, what do you mean by useful? Like, I might find that I came across this article that I should be eating ginger and rubbing garlic all over myself to be in line with my holistic worldview. I find this very useful, but it might not be accurate.
Yeah, and what is easy as well. So, yeah, great. And then here's the next one. Right now, I'm most worried about, and then you need to choose one: contracting COVID myself, friends and family contracting the virus, having to shelter in place, or losing my job. And it gives an option for more than one reply. So, apart from the fact that the SMS would have allowed only one response in our exercise. What are any of the other worries that people may have that we're not capturing here? How would you formulate this so that you would get feedback on the worries that people may have? And this comes back to what Liz was saying earlier. When you're thinking about, researching people's worries, very likely a focus group or some other qualitative research may give you more nuanced response than this. Elise, do you have any comments in addition?
Yeah, and again, this is where the pre-testing part would come in. But sometimes we also have to remember that the terms that are being used to explain things don't always translate to other languages or other contexts. So, for example, in the U.S., we say shelter in place, which actually is the term that was started in California, which is used to describe what you're supposed to do in an earthquake. And that sounds much nicer than quarantine or lockdown, which is why it kind of has taken on resonance in the United States. But that term does not translate to other contexts. If you're outside of earthquake country. So thinking about what do people understand by having to shelter in place? It might be some sort of other term, whether it's socially distancing from others or staying with your pot. I mean, it could be many different understandings of what that means. I also would be worried about D. If you had Ministry of Health administering this question, would you really want a response option that's about how are you worried about losing your job? Because what if you're taking the survey and you're like, oh, geez, well, I wasn't worried before, but now I'm kind of worried because you're asking me this. I mean, because there might be other things that might affect your job, right? Like that you run a business and that you're that there's less that there you're getting less money coming in the door, or that you think your work hours might be cut, or that you'll lose your job. Like there's many degrees. And so you might also want to capture this into like a larger bucket of like economic or money worries, like I worry about providing for my family. I'm worried about, buying food for my family. I'm worried about paying for my child's education. So there's many different variations. And again, this is where because this is a why question, why are you worried about, why are you about it? The why is something you can better address in a focus group discussion or some other type of qualitative assessment.
Mm-hmm. Yeah, and here's the next question. Who would you like to receive COVID-19 information from? Family and friends, community leaders, doctors, Ministry of Health, World Health Organization, and other. And it assumes listing, but that wouldn't have been possible in our case. Yeah, so who would you like to receive COVID-19 information from? This also implies a value judgment a bit in the question. It's not neutral. It's asking me to pass judgment, or it's encouraging me to do that more than where do you receive information from? Where would you like to? So normally you would ask, where do you receive information from? And something along the lines of, do you trust the information from X or something like that?
I would also be the first to point out that doctors do not make a health system. There are many other kinds of humans that operate a health system, including nurses and allied health professionals. So you also want to recognize that, although people tend to trust their primary healthcare provider, that's going to look different in different systems. So I would just be very careful as well about the labels that you use to describe people who are respected in the health system, because it can look very different from place to place. I do appreciate that you're trying to get at, basically this value judgment about what would be most most relevant. And it's interesting that World Health Organization is listed here. Now, from the survey results, if you looked at the trust index that was sent to you, that there is a specific part of the population of Eleanor that does not trust the Ministry of Health and feels much more strongly that WHO is a more credible and trusted source. The problem is
alternative medicine, which is not actually on the list.
Correct. That's also not on the list. But also the thing is that you cannot disaggregate the SMS responses. So it'll be very difficult to parse out, who is from a specific community that says, World Health Organization is my response. And I appreciate where you're trying to get at with this question, but it's complicated.
Yes, it is. Well, here's two more. I know that we're kind of long. Maybe we should speed this up a little bit. But here's the next two. First question, would you agree that the main symptoms of COVID-19 are fever, fatigue, dry cough, difficulty breathing, and body aches? And then the response is yes, no. And then the second question, do you practice all three measures to protect yourself and others from COVID-19? Frequent hand washing, maintain physical distancing, and wearing a mask? And then yes or no. I think these two questions also are a bit leading. We're basically giving the answer about what the main symptoms are, and do you agree or not? And it's highly likely that the responses are going to come back biased, where people will tend to say yes to both. So this is really difficult. Apart from the fact that, if you receive the data back and even if there was no bias, what would you do with the no question? What if people don't have enough information about any of these symptoms and they would have had to say no, but then how do you figure out, well, what kind of information do you need to pump out to clarify the symptoms that perhaps they don't know enough about? So it's really practical. It's very easy to answer an SMS survey, yes or no. And I think actually this is really, a good attempt of trying to simplify the response to the person. But the trade-off here in this particular example was that then the questions became complex, which makes it much more difficult to interpret the results when you receive them. What do you think, Liz?
I totally agree. So I think we kind of covered that. And maybe it's the next one about 1 to 5, based on your personal assessment. I know how to protect myself from COVID-19. So this question only makes sense if you have another question on the survey that figures out, well, what do you do to protect yourself from COVID-19? Because you're assuming that I know how to protect myself from COVID-19 are all, that they're doing the correct behaviors to protect themselves and not the incorrect behaviors. And so this is where you really want to think about what are the other questions in the survey. Again, we only said 2 questions on the survey, but this is only going to help you understand your population in context of another question to understand what do people mean by I protected myself. What exactly does that mean? And then maybe to the next question about how likely are you to share the names of your contacts if you tested COVID-19 positive. This is an interesting question. It is a theoretical question. And I think what the attempt here is to get at maybe at a stigma. And it also assumes that the person who's taking the survey knows that they're supposed to share their contacts if they test positive for COVID-19 and that contact tracing is up and running, which is not always the case.
Here's the next 2. Do you believe COVID-19 is a serious threat to you and your family? Yes, no, I'm not sure. What should you do if you have COVID-19 symptoms? And then there's three options. So I like that you have yes, no, and then the third option, I'm not sure or don't know. That's a really good practice. Do you believe? So we're asking for beliefs of a person. Something's off. I can't explain it here, but with the formulation, it's for me. I don't know. Maybe Liz, you can actually chime in on this one. With asking for a belief directly, I think creates a bias there as well. It's a lot easier, I think, if you're asking for a statement, for someone to affirm a particular statement relating to, I'm afraid for my family. But when you're asking for a belief, that causes a pause.
And also, this assumes that you have a family. That means mom, dad, kids, or some combination thereof. And so you also might have a different value of how serious you think the threat is to you personally versus your children, or your parents, or anybody else in the family. And then maybe similar, what should you do if you have COVID-19 symptoms? I appreciate that you're trying to get really specific with different types of actions people could take. It also depends on severity of symptoms. If you just have a cough, you might have a different response to this than if you're running a fever and you're unable to breathe and you're struggling to stand up. And so stay home and contact your local health center. Stay home and don't alert anyone, and continue your normal daily routine. So again, I would think this is more of a focus group discussion type question to really understand people's thinking process.
Right.
And
so this
similar
is the last
to, yep. And this is, I think we kind of covered some of this already. The best ways to protect yourself. Again, there's no other option for other things that you think might be protective but aren't actually protective, that are limited. And same thing with the how to get information COVID-19. Tina, what do you think about the last 2?
The last 2. So do you believe taking proper protective measures can help you avoid from getting infected? Yeah, this is a similar situation as before. What is a proper protective measure? How do you know what the person actually means by proper protective measure? As Liz was mentioning earlier, it can be anything from eating garlic, drinking vitamin C, to washing hands and wearing a mask. So that would need to be a little bit differently formulated. Although the response option, yes or no, is making it very easy. Although, yeah, I would also add don't know in that.
It also assumes that the person who's taking the survey feels like they should be taking preventive measures at all. You know, you might be talking to somebody who feels, I don't feel I'm at risk, and I shouldn't have to do anything to protect myself because there's no risk. So again, you want to make sure you're not feeding the answers to the questions you're hoping to get.
Yeah. And same idea with the second one. You're also implying to the respondent that they should be taking protective measures, and you're also listing them. And you know, with the responses, we had a similar question earlier. It would be very difficult to then get enough information from the response to be able to know which of the protective measures and need to be further explained or promoted in your risk communication, based on the way that the question is currently formulated. Yeah.
So the bottom line is that question design and survey design is very complex, and we asked you to do an impossible task with basically no time, and you guys did a great job. But hopefully walking through this with some of the thought processes for how you might want to think about questions is helpful to you. We'll also post more resources, including that tip sheet that we were showing earlier, if you are interested in learning more. But generally speaking, there should be somebody that you're working with that's really into survey design, and that you can consult on this. This is definitely a type of process where it's helpful to have an expert help you think through some of these issues. But great job. We're very impressed with the innovation in trying to come up with ways of answering try to get a lot of complex information out of simple answers and unthoughtful questions. So great job. Keep going. You already got the info drop about the latest SMS question survey results. So hopefully you will find that helpful and interesting. Again, that's not to say that these are perfect survey questions that were posed in there, but we hope that walking through these questions kind of gives you a look into the thought process for how do you get decent amounts of data and quality data out of questions that you're asking. Tina, any other last wisdom?
No, really, we're really proud of you. You've done an amazing job organizing yourself and you know, getting through a really time crunch, discussing all of these. You'll also get feedback on the hotline, but really good job. And I hope you get some fun out of the data analysis, the two info drops that you just received today. So see you soon.
Great job, guys. Bye.
Bye.